Hi, it's April 15th, 2020. Dr. Noel Williams, Oklahoma City, Oklahoma, Optimal Health Associates. COVID update, an incredible day if you're interested in COVID-19 and what's going on both in the state of Oklahoma, in the United States, and in the world. This is probably the most significant day in a long time because of some things that happened. But first we'll do some statistics. Well over 623,000 cases in the United States. I think 31,000 deaths. Internationally, we're over 2 million, 2.06 or 2,660,000, 135,000 to 140,000 deaths. Oklahoma, we're at about 2,400, and we had 11 more deaths today, so I think we're at 123. So it was one of our bigger days of death today, unfortunately, and my condolences to people who lost family members today. And we would expect that to continue over the next 10 days, irrespective of what Governor Stitt thinks. But we'll get to that. So first, let's do national stuff. So big news story today. So if we look back on, sometimes you have to pat yourself on the back. And being a data nerd and reading journals that were really, really boring back in February, that Thomas Boyle, the professor emeritus at University of Illinois Law School in Chicago, who's defended the Palestinians, the Bosnians at the World Court, and is the one of the world experts on biologic weapons, he wrote a memorandum documenting why this was a manufactured virus. Well, and people have blown that off, and keep in mind, he got excoriated. Multiple scientists have been excoriated. Well, the U.S. Defense Department today started sharing data illustrated that no, the virus was indeed made at the Wuhan lab. It was not supposed to be a biologic weapon. It was an outgrowth of the Chinese trying to show that they were just as good at virology as the United States, and were going to be able to make vaccines against these types of viruses. But there'll be more and more data on this. But no, it's a manufactured virus. And again, common sense matters in decision making and analysis. Okay, it trumps everything. It just always will. So you have a coronavirus, and then you have changes in coronavirus that led to SARS and MERS. But the genetic mutations all made sense. And then along comes COVID-19. It has two unique mutations. The first one is when we look at our protein that comes out of it, the protein stem or finger on COVID-19, instead of being both like this or like three that are the same length like this, the middle one is like that, which made it more clingy. Totally not documented to have ever occurred naturally. Data at University of North Carolina, where they mutated the virus to do that with a Wuhan scientist. Number two, as we've talked about, we have the longer finger versus the normal. At the base here at a cleft, I'll do one right here. So imagine right there at this cleft, there's a genomic sequence from HIV. Very odd, since there's no relationship between coronavirus and HIV, and there's a genetic sequence that completely matches HIV that makes HIV super infective. Data from Winnipeg, University of Winnipeg Virology Lab on mutating the SARS virus to have that. Wuhan virology people there. And then voila, we jump forward to now, and suddenly we have a virus that has a long protein finger, and the cleft right here for HIV have never occurred spontaneously, only been done in labs to add it to this. And so now we're starting to see the fingerprint of the mistakes from the Chinese government. So very important, very, very important. So all the people who got excoriated, crucified, made fun of, Tom Cotton, the Arkansas senator, all these other scientists. Let's think about the media for a second, folks. The media is not about the truth. So you have to remember that. So the lies that liars tell matter. So no one's going to go back and say, oh, I'm sorry I embarrassed this academic to the point of humiliation. The Indian university that published a genomic sequence analysis that said it was manufactured had to retract it because of all of their criticism and crucifixion in late January or early February. So no, it was a manufactured virus, and that's how it is. And when you have one of the world-renowned virologists say that yes, it could have occurred spontaneously, but it was very improbable, and to put their improbability in perspective, he said, imagine taking 5,000 bats, hooking them to a petri dish for eternity, and perhaps the coronavirus could mutate into this because it's two separate mutations that have never occurred. So yes, it was plausible, but it was incredibly impossible. So let's go with the fact that common sense and science matters, and stop abusing and criticize people who don't agree with the media. And it's tiresome. So that's point A. Point B is follow the train of the information. U.S. military intelligence services determined that there's a major viral event, comes back to the Defense Intelligence Agency, goes through all these high-level secret meetings with Fauci, Azar, people at the CDC, National Security Agency, through December, makes Trump's briefing on January 3rd, the day before the impeachment, when all other kind of things are going on, and somehow he didn't recognize it or understand it, which would be totally normal in any memorandum to a busy person where they got 8 million things to do. And when then you have Fauci, and there's people who get mad and who've made him like the savior of the country, like Stephen Colbert, which is just idiotic. Fauci was the person who knew from the beginning how bad this was, and he continued to say the entire time that it was a nothing, it was a nothing, it was a nothing, it was a nothing, it was a nothing. He didn't activate any of his connections. He is the most influential scientist in the US government. He's been there the longest in power, and power matters in government. He loves being a media star. It's his favorite thing. And if you go to the National Institute of Allergy and Infectious Disease and you go to their homepage, go to it if you don't believe me, please. It's an homage to Dr. Fauci. The homepage has 3 separate pictures of him doing stuff. You click on the little dot thing on the side to open things up. Kim's laughing because I don't know the name of anything. And it opens the choices. It's Dr. Fauci, Dr. Fauci, Dr. Fauci's accomplishments. I don't give a shit about Dr. Fauci's accomplishments. He's not supposed to be known for that. He's supposed to be protecting us. It's a U.S. government page. Why do we need, it's not about him. It's about the infectious disease service. But no, it's about Dr. Fauci. So he tells everyone in the government this is overblown. It's not important. So of course the people who don't know anything about viruses, like President Trump, Governor Stitt, all these people, so they depend on people. So yes, then now he's saying he told Trump on the 26th or something of February, but you got to keep track of this. You know, if your experts are telling you it doesn't matter, you can't get as mad at the people that are in charge, even if they're a very dislikable person like Trump is. I'm sorry, he's dislikable. That will offend a lot of people, but he's a very dislikable person. So, but you have to understand where it's all coming from. They depend on experts. So we're going to see his crucifixion one day, and Redfield at CDC, and Azar at Health and Human Services, but I don't think he's as much his fault. It was the people who had been there. The people who failed at the U.S. governmental level are the same people who failed in Oklahoma. It's the people who have been there, whose job it is to protect us. And they're just not doing it. So let's talk about Oklahoma. So the big news in Oklahoma today is Governor Stitt, from completely left field, announced that elective surgeries open on April 26th. This has caught every hospital, at least in central Oklahoma, since, to be clear again, the state is not communicating with any of the hospitals. Okay, they don't communicate at all. They come up with these plans. They don't tell any of the hospital administrators what to expect, nor do they ask their opinions on, should we open up elective surgery? Are you guys ready? Do you have enough, or gals, are you ready to open up elective surgery? Do you have enough PPE to handle COVID cases and surgery, since a lot of surgeries elevate spread of COVID because of intubation and stuff? No, the state doesn't talk to anyone in Oklahoma City, any of the chief medical officers. No one has had any contact. The OSMA did not know about this. And Stitt just today says, we're going to open up elective surgery. So that's a little crazy, since the peak is still projected now. They changed it yesterday, the state health department, from the 21st of April to the 30th of April. In Stitt's comments, he said it peaked March 30th. No, it didn't, but okay. I mean, he knows more than all the doctors, all the epidemiologists, and everyone who's medical in the entire state. Now, I'm sure he can trot out someone who he has not done so far, and maybe it will be the 34-year-old infectious disease doctor who's on the committee that no one in the entire state knows who she is, as his expert who said to open the state. But every mainstream hospital in Oklahoma City is taken aback by this because they're worried. But it's happened. So surgeries are going to open on the 26th. All the hospitals are gearing up to have appropriate PPE for their providers and the patients. So we'll get through this and we'll be fine. In terms of office visits, the whole issue with this is not the same. So if you're going for routine eye checks, gynecological exams, any of the routine things that you do for medical care, you should be fine. There's a little bit of question on dentistry, and I don't know what they're coming down on with that, just because there's a little more COVID risk with dental procedures and dental cleanings because of the irrigation. That's not clear. But at this point, there's going to be normalization, at least of clinic visits, which I think is completely reasonable if your clinic is screening and doing appropriate things. But the hospital stuff, not sure the big hospitals have the necessary equipment or PPE in place to handle it. Smaller hospitals most likely do, which makes sense. Like I don't want to potentially say anything inappropriate in terms of saying and giving an example, but just potentially as an example, if you look at Oklahoma Heart Hospital or the neuroscience over by Mercy, or you look at the hospital I'm at, Community, or some of the smaller hospitals, they have been received PPE. Their volume of cases isn't as much, and they don't take care of COVID patients. So some of that makes sense. It just catches the big hospitals like Mercy Baptist, Integris, this whole system, OU, Saints, Midwest City, and Norman a little bit off guard, but everyone's working hard to adjust to that. So that's huge news that the state is beginning an opening process with not involving the stakeholders, but that's, I think, kind of Stitt's methodology currently, because he hasn't involved the stakeholders from the beginning with personal communication, the people who actually are doing it. And he is being sued by the Republicans right now because he hasn't involved them in any of the decision making on finances, which is kind of interesting. So, it's just kind of how it is. As we look towards the next week, I would definitely encourage everyone to stay home. The peak now is April 30th, not April 21st. We want to have everyone still stay at home, social distancing. Governor Stitt has said that the rest of the opening in the state will be at least after May 6th. I don't know if he'll stay with that or not. There's been no comment from the Oklahoma City mayor, David Holt, that I've seen, who's really done a fabulous job on this. Likewise, I haven't heard any of the other mayors who have disagreed with Governor Stitt where they are. So just interesting times. It illustrates that when you don't have a unified plan across an entire country or state, that there's a little bit of chaos and things happen. But we'll just have to see what goes on. I want to do a couple quick shout outs. First to, I hope they don't mind, the Morse family, John and Bliss. They sent me a great article on AI and how AI is helping determine drug that can work against COVID-19. Basically, you have a smart AI. It can sift through all the data that it would literally take 250 scientists and statisticians to look at drugs that could work against COVID. It would take them a year. 250 people working a year, and an AI, a smart AI, with the help of just a few scientists, sifted through all the data in literally 3 days and came up with a drug that's a rheumatologic drug that appears to be incredibly active against COVID, stopping the inflammatory cascade and killing the COVID virus. And it just shows what AI can do. So thank you for that article. Another shout out to Danny Barnes, MD, best urologist, along with several others. I have a ton of urologic people I love, but Danny and I go back 25 years. Miss talking to you, Danny, and keep at it in terms, he's the school board president for Deer Creek, trying to figure out next year's stuff and when to start school and all those things. And I want to say hi to all the people I know in education and all the people I don't know. Thank you, thank you, thank you. You all got screwed by this deal, trying to teach all these kids, do all this stuff, figure out how do you do graduations or not do graduations? How do you attend to all these things? How do we satisfy emotionally these children who have kind of just had schools blown up? And how do we start again? What do we do? And I know all of you are thinking really hard about it. And thank you for doing that for our children. Our school administrators are doing it, but school for our children. But I just can't say thank you enough at every level, whether it's OU or OSU or the high schools or whoever. Give the school administrators a break. Please be nice to President Haraz at OU, and I'm blanking on the president. I'm blanking on OSU. They're all trying to help us and help our children. So give them a break as they're figuring it out, because this is like making sausage. It's very difficult. You're just throwing stuff together and hoping you come out with a good plan. So that's enough of me tonight. Take care and good night.